My name is Lih-Ming Wong. I'm a urologist here at St Vincent's Hospital. At St Vincent's we work very closely in collaboration with our medical imaging and our nuclear medicine department. The PETAL trial is an exciting trial we're running at St Vincent's Hospital. It's for men who don't already have prostate cancer, and for this group of men it's an opportunity to be involved in a clinical trial that's comparing MRI prostate to PSMA PET. Essentially we are comparing the two forms of imaging to see if the new form of imaging, PSMA PET, is better than or equivalent to MRI prostate. The name of the trial, PETAL, is short for the prospective evaluation and comparison of multiparametric MRI and PSMA PET to diagnose and localise prostate cancer. Prostate cancer is the most commonly diagnosed cancer in men. It's estimated that in 2020 there'll be over 16,000 cases detected in Australia, and 1 in 7 men will be diagnosed with prostate cancer before the age of 75. Whilst it's recognised that a lot of prostate cancer is non-lethal, there is still a significant death rate attributable to prostate cancer, with an estimated over 3,000 deaths in 2021. This makes prostate cancer the second most common cancerous cause of death for Australian men, and it's also estimated that there'll be over 6,000 deaths attributable to prostate cancer in a year. Currently, men who are concerned about prostate cancer are assessed based on their family history, the digital rectal exam on how the prostate feels, and then finally on a blood test called the PSA, or prostate-specific antigen. In Australia, the gold standard after these preliminary assessments is to perform a multiparametric MRI, which has enabled us to look inside the prostate. And this then enables us to target the area of abnormality within the prostate at biopsy to better and more accurately detect and localise cancer within the prostate. The other benefit of MRI is it has what we call a very high negative predictive value. This means when the MRI suggests that there isn't any cancer there, it's correct 70 to 80% of the time. This allows some men to avoid an invasive prostate biopsy. Since introduction of MRI to the Medicare benefit schedule, we did some research which demonstrated a significant reduction in number of prostate biopsies performed and an estimated saving of $13.2 million. However, no diagnostic test is perfect. Given the extensive research into the ability of MRI, its limitations are now apparent. It is estimated that approximately 20 to 30% of MRIs which are reported to be normal will actually harbour clinically significant prostate cancer. We also know that multiparametric MRI of the prostate can have difficulties in differentiating between benign, non-cancerous enlargement of the prostate with some types of cancer. There are also some men who can't have an MRI of their prostate because they've got a cardiac pacemaker or a cochlear implant. And we do know that if they've had hip replacements, the metal causes artifact or distorts the image, degrading the ability of MRI to perform. MRI of the prostate is also heavily dependent on the radiologist's experience in interpreting and reporting the MRI, and it's well known that there is a learning curve associated with reporting MRI. This is why it's beneficial to have the MRI done in a high volume tertiary centre like St Vincent's Hospital. This is why we've proposed the PETAL trial, which is a direct comparison of multiparametric MRI and PSMA PET. All men in this trial will receive both forms of imaging. This will be performed in a high quality, high volume centre like St Vincent's. Ongoing follow-up of the imaging is done by the urologist of your choice. Currently, most of the men recruited are from St Vincent's Hospital and the urologists that work here. However, the trial is also open to patients at Melbourne Health, Epworth Health, and an international site in Christchurch through our partner Pacific Radiology. We hope to open the trial at Sydney Adventist Hospital soon too. For all patients, the cost of the imaging is covered by the trial. The study has been supported and funded by Cyclotek, General Electric Healthcare, and an Australian Government Cooperative Research Centre grant. We've also received funding from the Epworth Medical Foundation, Reese Bathroom and Plumbing, and philanthropic donations from the Pitcher family and the Chakuto family.